So movement is widely believed to relate to low back pain. And if we look at people with back pain at a single point in time, they typically move with less range, less speed, and more muscle activity, or an absence of flexion relaxation. But if they improve, we know little about whether that's related to a change in their movement. So our objective was to investigate the relationship between changes in volitional spinal movement, including muscle activity, and changes in pain or activity limitation at the individual level in people with low back pain. To do this, we conducted a systematic review that was prospectively registered on Prospero. Our search strategy was developed in collaboration with the faculty librarian, and then we searched 4 electronic databases from inception to January 2020. These were Medline, Embase, Sinal, and ARMED. We included studies if they were peer-reviewed articles, and they reported the relationship between movement and pain or activity limitation. Importantly, this relationship had to be reported at the individual level. We then synthesized the presence of a relationship among the different movement parameters that were investigated, be that flexion range or speed, extension, or other movement parameters. Then, if there was a relationship, we wanted to understand what changes in movement actually related to improved pain or activity limitation. So what do we find? Well, we identified 27 suitable studies involving almost 3,000 participants. Overall, the evidence was of low quality for our research question. A relationship was identified 31% of the time between changes in movement and changes in pain or activity limitation at the individual level, or in 20 out of the 65 times the different movement parameters were investigated among the 27 studies. When there was a relationship, improved pain and activity limitation was consistently related to increased range, increased speed, and decreased muscle activity. So what can we conclude from this? Well, we infrequently observed a relationship between changes in movement and changes in pain or activity limitation at the individual level. However, a lack of high quality evidence currently precludes definitive understanding of this relationship. For further information and to read a discussion on the topic, please consult the full text at the Journal of Orthopaedic and Sports Physical Therapy.